People in other countries are literally dying for what we throw away. Imagine you're in a hospital and in need of care. Imagine being unable to receive treatment because some of the most basic materials are simply unattainable. Bandages, beds, needles, sutures, syringes. A life-saving surgery is canceled because no sutures are available to sew the incision. A patient must endure unsafe conditions, armed only with hope to safeguard against infection. In developing countries, patients often sleep two to a bed or in makeshift beds with few, if any, clean linens. A lack of even the most basic medical supplies is the dire reality for many healthcare professionals and the families they care for. Around the world, more than 500,000 women die every year from complications of pregnancy and childbirth that are often preventable. For every woman who dies, approximately 30 more incur injuries, infections, and disabilities that can be lifelong. That's almost 16 million women a year. In the United States, these situations are unthinkable. But in the poorest areas of Bolivia, Guatemala, Nicaragua, Cuba, Jamaica, and other neighboring nations, the challenge to heal and to give birth with minimal resources is a daily ordeal. In stark contrast, American healthcare facilities have a surplus of still useful materials that cannot be put back into use due to institutional regulations, upgrading and remodeling, and changes in vendors. Each year, U.S. hospitals throw away 2,000 tons or $200 million worth of unused surgical supplies from operating rooms alone. In 1989, Global Links was formed to address, in a socially and environmentally responsible manner, the desperate need for basic medical materials in developing countries. Yet our mission is much more than the provision of materials. It is the improvement of health. Through strategic partnerships and long-term collaborative programs that provide doctors, nurses, and other healthcare professionals access to critically needed equipment, furnishings, and supplies, Global Links has improved the health of millions of people around the world. Most of this life-saving material would likely have ended up in a landfill. Instead, Global Links matches this medical surplus, recovered primarily from Western Pennsylvania and the surrounding region, with requests from hospitals in many of the poorest countries in the Western Hemisphere. Working with receiving hospitals and health authorities, shipments are assembled only after careful assessment of needs, limitations, and priorities. This is important because inappropriate donations can overwhelm hospitals and cause problems that are almost as serious as the situations they were meant to address. With the right equipment, dialysis for kidney patients is now possible. Equipment and supplies to safely attend births means more mothers and babies can survive and live healthier, more productive lives. Casts for broken bones make the difference between permanent healing and lifelong disability. Instructions and manuals sent along with medical devices allow healthcare workers to become more skilled and self-sufficient, raising the overall level of care. With blood pressure units and EKG technology, many treatable conditions can be detected early, and as a result, lives are saved. Currently, Global Links works with a wide range of healthcare institutions in the United States, including hospitals, physicians' offices, senior care facilities, home care companies, and the community to recover hundreds of tons of surplus materials annually. In addition to supporting our overseas programs, these materials also benefit local free clinics and health centers, animal welfare groups, and health worker training programs in our community. Global Links relies extensively on volunteers from the greater Pittsburgh community to prepare these materials for donation. Each year, groups and individuals from across our community donate over 6,000 hours to help recover and prepare medical supplies, sorting, cleaning, checking, painting, and packing materials to ensure a quality donation. Global Links appreciates the community support it receives, yet it is recovering only a portion of the region's medical surplus. What's needed is more involvement. Involvement from top management and healthcare institutions to recognize that a commitment to recover medical surplus is not only smart and environmentally responsible business, it saves lives. With Global Link's infrastructure in place, a growing team of volunteers and continued funding from organizations and individuals, the medical surplus from our region can advance the quality of life for thousands of people in our world. We need more surplus materials, more volunteers, and your financial support. No one should die for lack of what others throw away. With your help, Global Links is working toward the day when no one does.